Well, welcome to the Big Data Revolution panel, Changing U.S. Healthcare. So I'm very excited this morning to see you all. I was expecting about half of these people for today. So I'm glad you all came early this morning. I think we're going to have an exciting session today. I have some great panelists here and some of the veterans of the industry. So let me introduce myself first. My name is Yuli Shedekali. By the way, it's spelled wrong in the program. Sorry about that. My name is Yuli Shedekali, and I'm an emergency physician with Kaiser Permanente. I think most of you know who Kaiser is. It's a large integrated healthcare system, mostly California and a few other states. I'm an emergency physician, but I'm also a researcher for Kaiser, and we'll be developing some cool technology solutions for research and care delivery. I have a group of researchers at Kaiser called Quest Network, and I see some of my Quest Network colleagues and innovation colleagues up there. Thank you for coming. And we have some interesting work that we are doing in Kaiser. So that is my interest. My interest in coming here and hearing these great panel members is to learn about big data technologies. So let me introduce the panel. I have Joe Caserta. That's Joe. He's a recognized technology solutions provider, writer, and educator. He's the president of Caserta Concepts, a New York-based innovation technology and consulting firm founded in 2001. Joe and his teams build data solutions for businesses and organizations in healthcare, finance, and insurance industries, frequently partnering with CIOs to help implement practical, accessible solutions using emerging big data, NoSQL, data analytics, and visualization. And then next to him is Matt Giovanni. He's a life science solution architect at York Data. Did I say that right?
Yes.
Matt is responsible for presenting York Data Solutions from a technical and scientific perspective within the life science markets. Matt joins us from IDBS, where he focused on delivering data management and software solutions in life science, with particular focus on translational research. So I'm very interested to find out what you do. And then we have Jeremy Stieglitz, drives product management for Data Guides, market leading data security, intelligence, and protection platform. Prior to Data Guides, Jeremy worked as Vice President of Business Development at Voltage Security, and as Vice President of Marketing, Product Management for Redwood Systems. So thank you very much. I'm very happy because now I can meet. Instead of being in the audience there, I can be on stage and I can ask you questions. So I'm very excited. Big data in healthcare. What's the status right now? I know a lot of people talk about how this revolution is coming, all the hype that goes with it. Where are we right now, and where is your company in this process? Say, what's the future?
So my as you kind of described, my company spans more than just healthcare. So we do a lot of our clients are in the financial industry, digital ad space, e-commerce, and healthcare and insurance. And if you could, we did comparative analysis across the spectrum. I'd say, in my experience, healthcare is kind of lagging. I think healthcare is different from the others, although ironically not terribly different from banking in the way that it's so highly regulated and the data is so sensitive that there's a different reason for it to lag. Whereas some of the industries, the technology was kind of scary, and it was hard for people to just dive in head first into this new paradigm. But in healthcare, it's really not about that. Like, in healthcare, the thing that's different also about healthcare is that people are incredibly smart in the healthcare business. A lot of PhDs, like a lot of researchers, and so the skill set isn't really the issue. It's really so tightly regulated, and there's so much fear around having data, sensitive data exposed. That's, in my experience, that's the part that's kind of stifling the big data in healthcare.
Matt, do you want to take a stab?
Yeah, absolutely. So first of all, just to kind of introduce our company a little bit more fully so people have an appreciation for what ArcData is really all about. Our organization is actually the big data division of Cray, the supercomputer company. And so when it comes to big data projects, this is something that our organization has been focused on for a long time in terms of helping the scientific and government communities take advantage of the sort of projects that they've embarked on. And so in a certain sense, some of what's happening now in the industry is not particularly new to our organization, although there's very many new elements and new opportunities in the form of a software platform that makes it far easier for folks to access big compute resources. But one of the challenges I think that we have as an organization, as the rest of, industry begins to adopt some of this technology, is that there's a lot of misconceptions about the players in space. And so one misconception before I got started to answer your question directly is just I want to dispel a couple rumors about our organization in terms of the kinds of projects that we tackle, because I think even when Jeremy came by our booth yesterday, for example, he was staggered by a couple of statistics he saw in a brochure. And Jeremy, if you don't mind retelling that story. He came by, saw a number on our brochure that said I think it was a 360 terabytes per hour is one of the I/O statistics on one of our appliances. And he was staggered by this because I think he said that one of the banks you were working with, that represented hundreds of times more throughput than they needed to handle all of the credit card transactions that they were involved in. Is that accurate?
All the credit card transactions on the planet.
Yeah, and so I think when people think about Cray as a company, and they see some of the numbers associated with the projects we're involved in, it can be a little bit intimidating. And I think one of the things that's a misconception is they think, well, that's not my problem. We don't have problems that scale to the level that would require real careful thought about how that computer is really built and designed. And I'd like to dispel that rumor, really, and just to share with you that the technologies that we're providing here, when you build compute, software, the network, and that's built harmoniously. You can solve incredible problems, certainly, like some of the problems we work with in the scientific community. But you can also solve very practical problems. And so when we work with healthcare, it's about taking some of the lessons that we've learned on our large-scale government projects and making that practical and deployable within the industry. And so I just want to start first with that as sort of background. In terms of healthcare, though, and where we see the market, in terms of where, let's say, the healthcare industry is, compared to other industries that we work in, compared to the scientific community, compared to retail, telco, intelligence, we're behind. And I think part of that challenge is that the challenges that we're facing in healthcare is the complexity, really. If you think about almost any other organization, regardless of what they're producing, it's a much more homogenized, much more structured type of business environment than we're facing in healthcare. And so I'd say that although we are behind, I think the reason we're a little bit behind here is due to the complexity. So I don't think we can really blame ourselves too harshly for where we sit today. It has to do with that complexity and the real challenge that we're facing. And I think where we need to be a little bit more creative in healthcare is we need to look and take a broader view of the sort of technology that needs to come together in order to solve problems here. There are much more significant privacy concerns. You mentioned the regulatory constraints here in healthcare. Regulatory constraints in healthcare, I have to argue, are far more complex and nuanced than anyone else is struggling with, whether that be the intelligence community, whether that be banking. There's just much more complexity in the sort of systems that we need to build, and I think that that's where we're going to come today.
Julie, I'm going to give a perspective from a security vendor. Data Guys makes data discovery, protection, and reporting for security compliance for big data. We do sit across lots of markets, so we have banking customers, healthcare customers, government customers. And so I wanted to give a couple comments to your question about where is healthcare. I'm going to go back to the invention of TV. Today TV has been around in our markets for 60-odd years, and it's innovating, right? People are changing TV to define it as YouTube. People are changing TV by having excellent programming on different paths to networks. When TV was first invented, they didn't know what to do with it. They used to go into radio sets and film the radio set as a way to make television happen. And I bring that up because I think in some ways big data started the same way. The first applications of big data were, we're spending a lot of money in a data warehouse, we can do it cheaper this way. Or we're doing something this way, and if we do it this way, we can add new data or do it faster. And so if you think that, maybe the first question you've got to ask is, why would you want to do big data? And I think the two questions to that is, you can do something cheaper that you are already doing. And that's the sort of low-hanging fruit of big data. So the second thing you can do is, we don't know yet. And sort of like what happened to TV. They didn't know yet that they could do all sorts of other things with it, and it continues to innovate today. And I think we're sort of at the end of the beginning, is maybe the short answer. Anyone doing their job right, certainly in the largest healthcare organizations in the United States, are looking at the obvious low-hanging fruit of big data. Ways to consolidate applications they couldn't consolidate before, ways to shift costs out of things that were, quite candidly, quite expensive to run before. And we're at the end of the beginning because the low-hanging fruit is identified, but the potential applications are unknown. And so, yes, healthcare is probably a little bit behind. We have some customers in Hadoop that have been doing this for 7 years, and they're at sort of what we would call ad hoc, ephemeral Hadoop. They want to tear up and tear down dynamic clusters on a daily basis to new users they didn't know about. I don't see that in healthcare yet. But it doesn't mean it's not coming. It just means that certain applications, Hadoop was a killer app to even just drive the reason for the business. Hadoop isn't the killer app to drive healthcare in the way that job number one in healthcare is to deliver health service. But I think the unknowns are interesting, and I think the low-hanging fruit is probably where we'll be for the next 3 to 5 years in terms of the mainline efforts here are going to be the consolidation, cost reduction, to do something you already know how to do, but do it in a more efficient way.
Thank you. That's a great point. Great points you all make. One of the things that comes to my mind whenever I talk about big data with consultants is that the healthcare organizations are not ready in the sense that they don't have the governance, they don't have the processes, they don't have the setup ready to take on this new technology, this new way of doing things. Any comments on that?
Yeah, I think for every solution there's 3 prongs, right? There's the people, the process, and the technology. The people, process, platform, all the P's. The platform, I think, is what everybody talks about. It's the sexy thing that, the nice yellow elephant that is, very appealing, very easy to get your head around what it is. But it's the people and process that's the part that's kind of lagging. And, especially in healthcare more than the other sectors, it's the most important, the missing pieces are the most important pieces. Just installing Hadoop and getting some data in Hadoop is not going to, revolutionize your industry. It's not going to revolutionize your company. What you need to do is really change the way you think about data, change your mindset on what data can do. I don't believe that putting the data in Hadoop is going, the big pitch right now is that, it's commodity hardware, it's very cheap. You can replace all of your Oracle databases with something at 10th the price. To me, that's not the driving factor for going to big data. For me, the big driving factor for going to big data is being able to experience data like you've never experienced before. Really taking the functional capabilities of machine learning and of taking unstructured data, making sense of it, correlating with your existing reference data from your data warehouse. And really cleaning, I hate to use the word insight, it's just such an overused word, but making predictions and making recommendations within the industry based on evidence. That is something that I think is revolutionary, and I think that's the part that has to be embraced, to justify some of the cost and some of the, overcoming the fear and the mystery of diving into this new paradigm.
carry on that thought, I would totally agree. I think that, a lot of us are looking initially at the low-hanging fruit in terms of how can we improve what we're already doing. But the big promise of this technology is really bringing, not only to health, but to all organizations that are focused on data-driven decision-making, is that we can do now new things, and we can create new insight. And I think in healthcare, there's more potential really than any other industry to get that done. Because, in the projects that we focus on, we're really trying to change the way physicians practice medicine by offering new insight in terms of how we can use the information we have from the genome to make more personalized decisions in the hospital. And although you may argue, yes, we have some challenges with respect to privacy and data governance, these are also challenges, though, that other industries are facing too. So I wouldn't say that these challenges are unique to healthcare necessarily. And I think that, once we kind of get our heads around how to make that happen, and I actually would congratulate Kaiser for being forward-thinking in this way, in terms of reaching out to the patient population and really establishing the kind of relationship we need to get access to the data that will allow us to make those game-changing new discoveries, as opposed to simply doing what we do today better. Let's do something new tomorrow that's much more effective and a real game changer in the industry.
I heard your question in a sort of security filter. So in terms of data governance, I think, what are we doing to secure our data? I guess the first question I would ask is, why would you want to secure data? I think at the most macro level, there's sort of two reasons organizations care about security. One is the sort of historic, traditional mindset that losing data either to theft or breach or hack is bad, and that's 40 years in the market. And the more recent one is compliance. I must show that I've actually protected data, because I'm going to be out of compliance. I'm either going to get penalized or fined or be out of audit. And I would say healthcare's grades are pretty good in the sense that they didn't have the 40-year head start that banks had. Banks have been researching cryptography since the invention of moving money on a wire. And the reason for that is they knew bad guys wanted it. I think in healthcare, the idea that there was a criminalization and a monetization to data is a relatively new thing. In the mid-90s, there wasn't a vibrant market that could sell healthcare data the way there is now. And in the mid-90s, there was absolutely active breaches on JP Morgan every day. And so healthcare has had a lot more breaches, I think, relative to other industries in the last 10 years, so it has a bit of a bad rap from protecting sensitive data. But I think the more interesting sort of way to filter this is the reasons to be really strong in security weren't driving the business 10 or 20 years ago the way they are now. On the compliance side, there's lots of compliance out there. There's 1,600 laws worldwide. There's 38 states with privacy laws. But I think the two big ones, or if you're dealing with credit card data, people pay attention to PCI. And if you're dealing with healthcare data, people pay attention to HIPAA. And so I would say, again, I think the score is pretty good that from a compliance standpoint, HIPAA has driven a lot of really good behavior in this market, more than, in the technology market, large vendors do really bad things, and you wouldn't know it, but, large vendors of how your phone gets made or how your software gets developed, there's no compliance driving them to do the right thing. So I would say I score healthcare pretty good in data governance.
Good. One of the areas that I'm interested in, from my background and where I'm coming from, is healthcare. You say, depending on the numbers, anywhere from 20 to 30, 40% of what we do is not necessary, or it may be harmful. The question is, which 30% do we eliminate? Is there any hope or this enthusiasm about big data helping generate new knowledge that we don't already have that would help in reducing cost or improve the quality of healthcare we deliver?
I could talk to that a little bit.
And if you have any examples.
Yeah, so I'm not up here because I have a product to sell. I'm not a vendor. I don't have software. I'm up here. I do provide services, but I'm really here because I think the healthcare system is extremely broken, and And I have a personal mission. I became a primary caregiver with my father with a disease with no treatment, no cure. It's called progressive supranuclear palsy, PSP. And I took care of him for 2 years. And part of the disease makes him fall. And every time he'd fall, I take him to the hospital. And every time we went to the hospital, I would have to be there to tell the doctor what his history was, what medications he was on, if he was on blood thinners, can he have an echo, can he have a CAT scan, and, what medications he had. And it was just ridiculous. So, today's day and age where I live and breathe data all day, every day, how could this exist? This should not exist. And then also, having a doctor, my own personal doctor, every time I go to the doctor, he's complaining about his insurance carriers, telling him what he can and cannot do. And then, and a lot of my clients are insurance healthcare payers. They do nothing but complain about providers trying to scam them. So I think that's one of the reasons why this industry is really lagging, because there's very, very little cooperation between facilities, between providers, and between the payers and providers, which is a little bit different than banking, right? Banking kind of controls, a bank is a bank. But ironically, I could walk up to any bank, put in my card, and it knows exactly what my balance is from any other bank, right? And I can actually take money out of that bank and deposit into that bank, and it'll find its way into the proper bank. If that can happen, my God, why can't I somehow go into any facility and have them know exactly what my health history is, exactly know what medications I'm on, exactly what's been tried in the past and what worked and what didn't work, and why can't I see that data? It's ridiculous. So that's what I'm trying. That's why I'm here. I'm trying to meet people and find some smart folks who can help me in my mission. And I think, the original question was, why are we lagging, right? And I think it's cooperation, it's sensitivity of the data, and
How do we decrease the waste?
Yeah.
And how do we
So-
take knowledge?
So with big data, some of the use cases that I see with my clients is, from the healthcare payer side, we really want to focus on performance, what's actually working. So we have diagnoses codes, we have prognosis codes, and then we have claims for medications. Which ones are actually effective? Which ones are actually reducing claims? Which ones are just being prescribed because the pharmaceutical companies are incenting them to prescribe them? This is real stuff. This is, it's wasting hundreds of billions of dollars and not making people healthy. We're in a society where we're all overweight, we're all bordering on obesity, highest, diabetes, in the world. And it's for what? I mean, it's because we don't have insight into what works and what doesn't work. And the incentive programs around the industry are just in the wrong place. So I think if we can, first step is to really understand what works and what doesn't work. And that's only through data. Right? If we can actually take, all of the diagnoses, all of the prognoses, figure out what's actually, what is the experience of the patient? Are they actually getting better based on certain procedures, based on certain medications? And then send to doctors how to do what's right, rather than to work based either on quantity, right, fee for service, or based on prescribing medication. And if we could do that, I think we'd be in a much better place.
No, that's great. Yeah, to follow up on that, I think so a lot of the focus that I work on in the projects that I'm focused on are around trying to understand the molecular basis for disease in the effort to help the medical community make more intelligent choices with regard to what intervention makes sense for a patient. We already know, really, that we can use this technology to help differentiate which therapy a patient can respond to. We can already predict in certain cases what they might have an adverse event related to, based on what we see genetically. But the challenge, I think, for us and our teams are that your genome really only makes up about, we think, maybe 40% of that picture. And the rest of the picture is in the choices we all make every day. Our environment and how much you sleep, your stress levels affect your biochemistry significantly. And these things are just as impactful in terms of how we're going to respond to an intervention. And so we're missing a lot of that picture. And so I think in your question may also be not only how do we make a hospital network or a healthcare provider more efficient and effective, which we are working toward for sure, but also how do we as a healthcare community in the larger sense make more intelligent choices. And one of the examples, like I said, we point to in terms of some challenges here is that we have a lot of evidence, for example, around statins in terms of what impact that has on our chemistry. But we don't really, and we don't have a lot of evidence to suggest that this is really actually helping anybody. And that's a staggering thing to say. With a category of drugs as popularly prescribed as statins, that we can't really clearly tell you that this is going to help you as a patient. We can tell you to lower your cholesterol on certain metrics. We know that for sure. But whether that's having an impact on your cardiovascular health, that's unclear. We got to get better at this. I heard an analogy from a professor who suggested that if you want to improve your golf game, you need to know where that ball landed to really improve your game. And right now, we're not always able to see what the outcomes are clearly enough to help us make the right decisions in medicine.
I'm reminded of a joke in a movie 20 years ago. There was a movie called Amadeus, and Mozart has this brilliant new performance, and he plays it for the king, and afterwards he wants to get a positive reaction from the king, and he asks the king, how did you like the performance? And the king, wanting to sound smart amongst the court, looks back at him and says, it was a good performance, but I would have used slightly fewer notes. And Mozart's reaction was, did you have those notes in mind? And which ones? Anyway, the reason for that joke is I think there's really, I'm going to follow on what Joe said, I think there's really two sides of the equation. There's how can data accelerate or get better insight faster to do a better job practicing medicine? And security can play a role there. There's a large informatics project that U.S. Department of Air Force is running. U.S. Department of Air Force has collected medical data on their airmen and airwomen for 40 years. And they realize, this is a treasure chest. The challenge is we don't want to reveal sensitive data. So they masked it in a way that was reversible. So it sort of de-identified the service people's IDs, but retained enough information so that if, John Hopkins later on determined this particular person had Tay-Sachs or a vulnerability to Tay-Sachs, they could route it back. And so, there is a role for security in data sharing that lets you do interesting things at a macro scale with data. But I think Joe's point is probably the more accurate one, which is, I'm not sure the fundamental reason for that inefficiency is data quality. I think there might be other fundamental reasons for that in terms of broken incentives or other reasons that tests are happening that shouldn't be. And I think the role for data to do the analytics, the sort of recursive analytics, is probably the richer one. And so I think it's in that, why did the money go here and what was the result? I think that's probably the more bigger pie to go mine in, so to speak.
Great points. Thank you very much. And, I have to plug in my company here. By the way, how many of you are local there? Okay. How many of you have Kaiser insurance? Good. About 40%. That's pretty accurate. How many Kaiser employees? Good point. But as Kaiser employees, they have a choice to pick another provider, right? Yeah, at least we do. So here's the point that I wanted to make, is that if you are a Kaiser member, which is a non-Kaiser member,
That's mine.
you have 30%, am I correct? 30% less chance of having a heart attack. 40-50% less chance of having a stroke. So I want to let that number percolate. So we do the job of prevention. And when we talk about standards, we did a study. One of our colleagues in Redwood City, right here. No, what they did was they looked at what are the things that prevent from a patient who had a stroke from having a recurrent stroke. And statins was one of the key things. If you give statins on the first admission, first day of admission, will decrease the frequency. So there is definitely some role. And the decrease in the heart attacks and then the strokes is because those drugs. High blood pressure, high cholesterol, and diabetes. So those three would be the first one. That's what we're doing. So great. So we talked about, what I was hearing was that the incentives are different. If the incentive is for a physician to prescribe more or do a procedure more, we're not looking at the outcomes. And that's what I get from the panel. Now, with Obamacare, is there any, how does that affect our big data strategy or journey for healthcare companies? Is it more important or less important? Does it matter?
I hope any major political shift helps the effort. I think that the one thing that I like about Obamacare, and I don't really, I follow technology, not so much politics.
Yeah.
But the one thing that I think I'm correct me if I'm wrong, is that he basically did away with pre-existing being judged when you're applying for insurance to use pre-existing health problems against you, right? First of all, the thing that's really interesting about the healthcare system, because the data side of things are so broken, a lot of it is the honor system. I tell you that I had a health problem. Whether that's right or wrong, it's really based on what I'm telling you. Right? There's very little evidence because there's so much disconnection between healthcare providers and healthcare insurers. But I do think that some of the better. Just to back up for a second, so I do a lot of speaking across the entire world. All over Europe, South Africa, Amsterdam, England, everywhere, and what I see is. Portugal is one that actually sticks in my mind where, they are, it is government, one of the big problems with Obamacare is, we're becoming, socialist, but the one thing that they have is they actually have, just like we have ATM cards, they actually have their healthcare card, and their entire history is on that. And they're regulated by the government for everyone to comply. And every healthcare provider, and not so much payers, but healthcare providers, every time you do a procedure on a patient, it needs to go on their record. And that record, that electronic health record, is shared across the entire country. And if Obamacare is working towards that, I'm all for it.
Yeah, one thing I'd say is, not to get to dice it up too finely, but one of the things that I'm seeing increasingly, and the federal government is helping, I think, in terms of redefining the access that patients have to their own medical information. And I think that that's maybe one of the most exciting things that I'm seeing from the Obama administration in general, is a more transparent view of what's in that record. And I think by doing that, it encourages patients to provide potential. We'll have to wait and see how this really unfolds, because it's all very new, and we haven't yet had developed the systems, I think, that are going to make this real. But when you provide greater transparency to the patient population, you open yourself up to the idea that perhaps we're going to be including things that are not normally included in that record that physicians might be able to do to make better care decisions for you. So, for example, one of the things that always strikes me as odd is that, as I move through my own life, I make hundreds of healthcare decisions that are completely invisible to the medical community that I'm interfacing in when I go into the hospital. Things like how much I ride my bike, how I see Fitbits on some folks here. And a lot of that data is very difficult to capture. And some of the things I see in the new federal guidelines are allowing the sharing of data to happen more meaningfully. And I think that that's going to have the greatest impact as we consider big data solutions in this space. And that's the part of Obamacare that excites me most.
Strictly from a security lens, Obamacare is a tiny blip compared to HIPAA. It doesn't drive the market the way HIPAA does. HIPAA drives behavior in the market that wouldn't have been there otherwise. past HIPAA, I think state privacy and breach notification laws have really changed the motivation of people to do the right thing. So Obamacare is this huge mass, but it's not a mass that intersects data security in the healthcare context.
Great. So we talked about processes and, of course, the solutions. What about the culture in healthcare in general? Is that, do you see that changing? I've heard that, it's very paternalistic, and especially the provider side, where they say, well, we know what you're doing, and so we do what I say. Now, is that culture changing because of more consumer involvement, more patient involvement? And how does that patient factor into the big data change we're seeing?
So one thing that's different about big data from other, IT or technology initiatives. So I've been doing this for 25 years, and I've seen a lot of transition going from mainframe to client server, from traditional data warehousing to dimensional data warehousing. And most of those initiatives are from the top down. There's some kind of requirement that needs some substantial change in technology. Big data, in my experience, has been bottom up. Big data is really, it's the geeks, who just are just tasked to get better performance and to get better scalability. And they're coming up with their own innovations, kind of under the radar, underfunded. It's one of the few, times in my career where, we hold a meetup in New York City where we just get together to talk about this stuff. And, on a Thursday night at 7 o'clock at night, we could fill a room with 200 people, all in their own time, not getting paid. So the revolution is actually, it's happening, and it's happening from the bottom up. So we're getting really smart technologists coming up with ways to solve the business problem without the business involvement. And then, just kind of doing their own little POCs because, they say this is cheap, but actually this really is cheap. We can spin up, a Hadoop cluster on AWS in a matter of minutes for a matter of dollars, and do POCs without even asking for permission, right? And, with companies like Data Guys and other, we could do, encrypt the sensitive data, so that's not an issue either, or just leave it behind for a lot of the use cases. And so I think part of the culture change is that this is one of the few scenarios where the technologists are actually influencing the business, and rather than the other way around. And hopefully, we could, when the business says that there's fear about, taking this data and doing new things with it, gleaning new insight out of it, correlating it with external sources, a lot of the technologists are going to say, we're already doing it. It can be done. We know it can be done. We just need the permission to actually take it to the next level, and the funding, of course.
Well, I think that's a great question. I'd love to hear your thoughts on that, really. I'm not in the healthcare community, but I do see, and I've heard stories of, one of the things big data can provide all organizations is more transparency into how their organizations are operating. And when you consider where we see large data aggregators working in hospital networks to identify, which hospitals are outperforming others, which physicians are outperforming other physicians, we're beginning to get a much clearer picture of the performance of this within these hospital networks. And if I were a physician today, I might find that exciting, but I could also find that very intimidating, truthfully. So in terms of the culture within the healthcare community now, I think there's just a lot of change, and that change is going to happen. I don't think anyone's going to be able to stop this train from moving forward. But yeah, it's a cultural shift for sure, and that has got to be unnerving for everybody involved. I would just love to hear your impression. You answer your own question about how you think that's going to impact either the progress that we have or what changes you see happening now that too at all.
If I could just add before you move on, one thing as far as the culture and especially the providers is, and the industry in general. It has to, I think big data is going to happen. Being able to get real insight out of the performance of the providers is going to happen. So I think the big culture shift we're going to see within the next year or two, it's not even 5 or 10 years, it's the next year or two. We have to shift into being outcome-based. Is what the provider, the actions that they take, do they actually work? Are they effective? Are they efficient? Are they actually making people healthier? I think that is something that has to happen culturally.
I'm going to address the culture of privacy. One of the sort of foundational ideas in big data is monetizing data. NCR in the late 70s started to convert its cash register systems to more digital systems and started to notice that they could see things about purchase behavior. And by the early 80s, they were selling that to financial institutions as a way to aggregate purchase data and gain insight from it. And that became Teradata. And then Teradata became a whole market around data warehousing and this idea that you could do post-processing analytics to make money faster. So clearly we've got to the far right, you have zero privacy and everything you do we want to try to sell you more to. And I think healthcare, to its credit, comes from somewhat the far left, which is privacy is sacrosanct, and what is sensitive to you about your pharmaceutical purchases or your health history is not a monetizable event. And even selling services to you is sketchy. Selling services to others related to what you're doing is absolutely forbidden. Technology sort of a little bit to the right, but a little bit in the middle, right? Companies in technology are mindful of privacy because they understand the capabilities of the system, but they do only an okay job guaranteeing it. And I think, from a culture standpoint, healthcare is going to float up and probably look and say, hey, I have a data as a service sellable model here. And we're seeing some of that, some inter-sharing of data from a drug research standpoint or health practices standpoint, but I don't know where we get to. I guess the interesting question is, where do we get to as a society for privacy and what do we tolerate anymore? There was an interesting woman on NPR a couple of weeks ago talking about, privacy is up to us to defend and we expect other people to do the right thing, but we don't do enough on our own to protect our privacy. But I guess my point is, it is a spectrum. I wouldn't call it reluctant or conservative. I would call it sort of institutionalized. And from when I think about my own privacy, I'm glad that they're down there. And I don't want them to be, I don't want them to be to the far right of how do I make money faster, extracting insight from what happens to my health. So I guess my health is more sacred to me than what I do with my credit card.
Good point. Well, let me give you my perspective as a provider. Well, I've been fortunate enough that Kaiser has been leading a lot of these networks and using data to better provide better services, better outcomes, better quality. And so, if you look at most of the consumer ratings, insecure ratings, or any of the bodies that look at quality of healthcare, we are the top in California, and most of the states here. So that way, in a way, I have a very skewed picture of healthcare compared to, say, somebody who practices in a small group of business. We are, in Northern California, there are 6,000 doctors, 21 hospitals, we have everything on the same system. So I'm coming from a very different perspective. I know that because it's going to revolutionize healthcare. And the folks that can do it the right way are going to be the winners. And I think, there's no question about that. Because with the constraints of the cost, with the constraints of people looking at quality, the constraints of consumers looking for a better satisfaction out of their healthcare. All these things we can drive with big data, so I have no doubt. And I'm sure a lot of my colleagues are more towards, they're more progressive thinking, mainly because they are in this system. I think that system itself has that potential. Culture is very different. And so I'm coming from that. That's why you see a lot of prejudice. Not that we equalize so many people, but that could be a factor too. But you saw other speakers from Kaiser. So we are very, very, very fortunate to be in that position. So this is the last item, and I want each of you to give us, the audience, an advice, 1 line, 2 lines, the wisdom. What would you recommend, or what is your pet peeve, or what is your pearl that you want to leave with this audience before we go into questions?
Embrace innovation. I think in your industry, I consider my industry as well, in many industries, innovation is your only competitive advantage. All of your competitors are investing heavily in big data solutions. There's new technologies being born every day. Get help, seek advice, and just dive headlong into it. I think there's tremendous opportunity in the healthcare space for personal growth and also for your company's growth. And I see, if I have my crystal ball, I think that a lot of the folks in this room may eventually come up with incredible solutions and spawn off and make new companies. If you have that entrepreneurial spirit, I think the sky is the limit. I think we're in an amazing time right now, more exciting than the past couple of decades I've been doing this. And there's no limit to what you can actually physicalize, the only your imagination. So just think hard about what you do, think about how you can possibly do better, and think about the impact on the industry overall, and just talk about it, come up with some ideas. And if you can think of a way to stop me from paying somewhere between $1,500 and $2,000 a month, every month to see my doctor for 15 minutes twice a year, it's just, there's something wrong, and there's got to be a better way. And you just need to figure out how to do it. The answer is there. You just need to work either politically, technically, or within the government, trying to impact the government, or just within your own company. Make a change.
Thanks. Yes, I don't know if what I'll leave you with you might call wisdom, but I'll give you my thoughts. I think, one of the things that's wonderful, I think, to be in healthcare today, especially with the big data revolution, is that, there are a lot of challenges, to be sure. But if you look at that, really, for us in this room, that really, for me, it represents opportunity, to overcome those challenges. And I see that really the big data revolution, I think, is going to have a bigger impact in our space than perhaps any other, really. But we need to be more creative than other industries if we're going to make that real. And so one thing I would suggest for those of you that are considering big data initiatives, to take a broad view of the technology that's available to you. Big data does not mean only Hadoop, for example, especially in healthcare, because there are so many complexities that we need to deal with in terms of the nuance data around our patients. You need to take a broader view of that technology stack. So I would encourage you to broaden that view to include other solutions like semantic technologies, for example, how important we're going to impact those types of technologies in making organizations. So I think it's an exciting time. I think there's a lot of opportunities for all of us, but I think in the healthcare space, more than maybe any other, you need to take a much broader view of what the technologies are available to you if you're going to realize those benefits. I'm
I'm going to take a more narrow technical view. I'm amazed at the speed of innovation in big data. It's just about a weekly basis that Apache something shows up. Apache Kite, Apache Yarn, Apache Falcon, Apache Storm, Apache Shark. The speed of innovation here is faster than I've seen in other parts of the industry for a while. What that means for you is a bit of a struggle, right? Do I buy the next phone or do I wait for the next phone after that? And I guess my advice to you is stay nimble. You know, don't be building architectures that assume batch processing, because one of the things happening in big data is the transition from batch to real time, and that'd be an example of trying to think nimbly about some of the changes. But I would also encourage you to jump in the literal sense that this one isn't going to be a fad. You know, big data will be to data architectures, you know, what Linux was to proprietary esoteric server operating systems. It will absolutely replace it. And so, you know, I guess my summary thoughts are stay nimble, because it's changing fast, and jump in, because I think it will let you run faster if you're in the stream than waiting on the side of the river.
Thank you. Thank you, gentlemen. Let's take some questions from the audience. And here's the microphone. Here's the Haley guy.
Doing some exercise. This is
Yes.
good. This is healthy.
This is good. Okay, I have a microphone here, and please come up here, that way people can see who you are, and you can follow the line here. Right here.
I think this was really interesting. My name's John. I have a comment, and then I have a kind of a question that stems from that comment from this discussion. So there were some comments about outcome data not having enough, and that's likely true. We would always like to have more outcome data, but with the rise of the EHR, we are getting more and more and more outcome data, so we are seeing that. I would argue that it's the swing instead of where the ball lands that would probably help, and we're not really looking at that swing as much as we can look at as available. And so to stem off of that, I'm wondering, are hospitals, provider groups, insurance companies the best folks to be looking at this data? And but they are the gatekeepers of the data. They're the ones that have the data. So how do outside folks such as yourself tackle that? How do you guys get into the data to be able to do this analysis that maybe a small hospital or a small provider group wouldn't be able to afford to do?
Like that?
I can start. I guess in my experience, it's two things. One is it's only internal data. So if it's a healthcare provider, we're basing our recommendations on analysis of claims data for the most part. And then the other opportunity I think I see is intermediary providers. So like today we have like Thomson Reuters where you can actually buy the party data based. It's cleansed healthcare data. By cleansed, I mean that there's no that information. But you can actually get that information and then correlate it and compare it to what you're seeing and experiencing in your own environment. So I mean that's what I see today. And I think the future is, one of the questions about culture was, it takes cooperation in order to use all of this data holistically, collectively, like you're suggesting. And people are people, and business is business. And I don't see, providers and insurers actually ever, becoming one big happy family for the sake of the good for mankind. So I think that the intermediary business, getting this data, slightly sanitized, so that you can do really analysis across different providers, across different insurers, and have more data to glean insight over a vast, a bigger experience longitudinal data for patients. I think that, that's when we'll start seeing more innovation as far as what do we do with the results. right now, we can only, do analysis based on the data we have, which is usually the distance from the data.
And speaking more from the research side, this is a huge challenge, frankly, in terms of how do we get access to data in order to discover anything really from it. And so there's large collections of data that we can identify with confidence that people do routinely share. So the life science community, I think, should be congratulated, in fact, in their creativity and how to make that engine really work. But what we often miss are the nuances around the actual patient experience. So although we can get gene expression data quite easily, although we can get other molecular information that helps us sort of aggregate that together to make important discoveries, when it comes down to actually getting the data about that patient experience, either A, delivered to us at all, because again, there's so many privacy concerns around that, or delivered in a way that's retained the fidelity around it. So if you consider the way that the clinical trials run, for example, where we basically forested all this data into a questionnaire, and we summarize smoking history sometimes with a checkbox. That's not providing the kind of detail that really gives you a complete picture of that patient's experience. Now, we need to be sensitive to some of these privacy concerns for sure, that's paramount. But we also have to recognize that we aren't seeing the complete picture often. And so insofar as we can allow that to happen seamlessly, it's incredibly important. It's one of the reasons I think that in terms of what Obamacare component of it is providing greater data interoperability and giving us a platform through which legally we might be able to share data more easily. It's incredibly important that we're able to do that. But it's a huge challenge, for sure. And it's not something I think that we can treat lightly, because patient privacy is very critical. And so insofar I think if we can provide that kind of comfort level for all of us, really, that our data is not being abused, it's going to allow us to move forward. But I'd say that that's the big challenge. And if I were a small hospital, I think I'd be looking for bigger partners to help me analyze my data. Because if you look only at the data that you're going to have access to when we're in a small community, you're not going to be able to see, some of these long data trends. You need a big amount of data in order to see and resolve what you need to. So I'd say partnership is important.
I have a pretty narrow security kind of question. So Jeremy, and I think all of you guys touched on patient data and the identification. And it's one thing to sort of mask the structured fields that are coming from the EHR, but there's a ton of the stuff in the unstructured notes and everything sitting there. How are you dealing with that? How do you put it in the in a blue box, if you will, where no one can sort of correlate all of that and figure out who this patient was?
If I had gone to bed last night dreaming of the perfect question, I wouldn't have gotten any closer than that. I'm going to repeat your question and then answer it, which is, structured data tells you where sensitive data is. It says column C is username. And so you can think about protecting it in a pretty clear and clever way. Unstructured data doesn't tell you anything. Voice-to-text notes, or doctor's handwritten notes, or PDF scans, or X-rays, or other data that doesn't announce the sensitive fields is a hard challenge for data privacy and security. We are bullish on discovery. We have a set of discovery technologies that will scan, search, discover, classify, and count sensitive elements at the element level. And so what that means is, if you want to look for addresses or usernames or dates of birth, you go into our user interface and you check those, and then the tool will actually try to untap those from streams of data. Obviously, that discovery process isn't perfect, and so it's a generalized way to get pretty good coverage. An example of not perfect. Banks want to know about ADA routing numbers. Those happen to be 9 digits. So do social security numbers. So do random 9-digit numbers. So we can type a 9-digit number, have a regex pattern for it, and go look for it. We can do some logical checksums because ADAs have a repository of valid ADAs, but guess what? There are some ADAs that look like social security numbers. So it's not a comprehensively foolproof way, but it is a way to analyze structure and approach the problem. I like that approach. There are other approaches. There are approaches that say, because I can't tap what's sensitive in an unstructured field, I'm just going to put a blanket over the whole thing and encrypt the whole thing. Those approaches are useful to solve some compliance problems, but they are not useful for the precision or granularity or sort of tiering of access that you might want to give out. And so a blanket is a nice approach to say, it's locked, and then the authorized users can unlock it. But we take a more specific approach that says, and I thought about this, other than discovery, I don't know of any other way to go do this. So the short answer is, we're pretty bullish on discovery as a means to start to try to do this pattern matching, but the other alternative is to say, I'm not going to try to identify it, I'm just going to lock the whole thing and then control who can open the lock.
Next question.
My name is Kurt. We are our company provide home care IT service to our health providers, patients. We use the wearable portable devices monitor the health status of the patients and do data analytics with sample data. And with the home care, I think the patient will be the center. It will be patient center, patient driven mode. With the patient has the true requirement what they need, what kind of healthcare they need. So we hope with the home care mode, we can do a little bit for the U.S. healthcare and for the big data revolution. It's coming. How kind of expert from insecurity, from big data, from EHR, and health provider. So with your help, I think we can make our home care into practice soon. So I would like to hear your opinion. How can we do the home care step by step? What should we pay attention? How can we make it help our patient, help our industry, so all offers can benefit from it?
Thank you very much. I think that's a very complex question, and we'll take that offline because these guys have been sitting here for 1 hour and they're leaving us a lot of this wisdom. We are running out of time. So thank you very much. And